Hello, greetings, welcome. June 26th, Friday. I'm Dr. Bill Bird. Thanks for joining us here on Facebook Live. And I'm excited to have as my guest today, Dr. Jay Reter.
Thank you for having me.
Yeah. Dr. Reter is a family practice doc at Lynn, Blvd and has filled many roles here at the hospital, including, president of medical staff or
Department of Medicine chair.
Yeah, for a number of years.
Yeah, 6 or 7 years.
Yeah. So I pulled him out from his busy day to join us. So I'm really glad to have him.
Sure.
So let me, and as you have questions, we'll kind of intersperse those here in my questions for Dr. Reter. But let's get going on some things here. And before I even start your questions, I'm going to try something a little different today. I just thought about this on my way walking over here. One of the shout outs I want to give, every week we talked about folks that, we doctors are just one part of a big
Sure.
team that takes care of people here at CGH. And one of the shout outs I wanted to give this week that I haven't actually done yet is to our laundry department. I want to thank them for,
Absolutely.
my gosh, there's so much laundry. And to that end, how much laundry there is and how much work that they do. I'm going to throw out a question that I want those of you who are listening to try to guess. So, do we do more or less than 50,000 pounds of laundry every month here at CGH? So I need to hear more or less. And Rebecca, remind me, when we get down here a little ways, we'll see what the consensus is, and I'll even ask Dr. Reter that and see what he thinks.
All right.
Something a little different we're throwing in here.
I like it.
Okay.
I like it.
Okay.
I know I've had some friends of the family work in the laundry department, and they were talking about how much weight and how much they did, and it was a hard summer job for that particular person.
Yeah, for sure. Okay, so moving on to you.
I'm ready. Take it on.
So tell me, I ask all my folks that have been on here because everyone's a little different in terms of this question, but what's your experience been like since, at least here at CGH, I think it was like March 15th until now, been like?
Well, I mean, I think I share the general sentiment that it's been different. It's been tough, it's been challenging, it's been stressful. But the first few calls, as you know, I do inpatient work too. So the first 2 calls where I had to go into the bubbles was a bit anxiety-inducing, of course. But once I got used to gowning up and putting on all the gear and starting to feel safe and sometimes feeling safer when you're in those units because you're wearing so much protection, then it just started to become routine, which I think is what which is what we do in healthcare, right? We get used to these sort of challenges, and the unusual or the emergencies hopefully become the routine so that we can focus on getting people better. So that part was of course stressful. My oldest children, my daughters who are in college, came home early, which they didn't like, of course, but from a family standpoint it was kind of nice to have everybody home, and my son in high school having that part was sort of a guilty nice, and again, I think that's another thing that as families we all sort of treasure now, how much time we're spending with our family and all that kind of stuff. So that's good. But I worry about, I still worry about my patients. I had transitions to do with some of my other roles, working as a hospice medical director and as a medical director at a nursing home at Citadel. I was supposed to give a shout out to hospice to the Rock River staff. I was there this morning. But anyway, I'll do all those later.
That's all right, anytime. Shout outs are good at any point in time.
But getting used to all of the changing dynamics of locking down the nursing homes, which is so hard, and worrying about all of the staff, all of the residents there, as it being such a tragedy that we saw in the beginning of the epidemic in Washington, and everything all the different facilities have done to not repeat that. So that has been stressful. And then in my role as a hospice medical director, our whole philosophy is getting, families together to care for people at the end of life, and now having to keep people away and social distance, and how do we grieve, and how do we? It has been
It's 180 from what you're.
Yeah. So all of that has been difficult, but I think that in general people have responded very well and very positively. I think we can be proud as a community, and while I think we all wish for these better days in the past where we didn't have to do all this stuff, I'm finding in general we're having a great compliance with the recommendations, and I've been kind of proud of the community and all of the different organizations I work with.
Yeah. So good. Good. What are some of the, in addition to what you just talking about, what are some of the key things you've learned during this pandemic?
Well, probably humility for accepting there's things that we can't control and we can't we've all sort of intellectually knew that a pandemic could come, but nobody, until it's here, nobody sort of really takes it as seriously. I think we probably all could have done a better job in general with infection control, hand washing, which you as an administration have been flying that flag for quite a long time and beating that drum, which is great. But masking and not just soldiering through when you have a cold to go to work, which again is sort of it's sort of a badge of honor, like I'm safe and I'm still going to work. So those are the kind of lessons. But I think again, to repeat a phrase, going back to a greater respect for family, and I'm talking to my siblings and my mom, I think, more often than I have in years, which is kind of a shame to regret, but at the same time, there's those kind of good things that have come out of it.
Yeah, good. What's your biggest concern right now with the pandemic, Jay?
Well, I think I'll echo what's being said a lot in that I'm worried about complacency, people becoming fatigue, people getting sick and tired, people kind of putting their anger towards, I see a lot of misdirected anger towards, government and health, that, why are they making us wear these masks, and loss of personal freedom versus trying to encourage public health and public safety. And, even as healthcare workers, I get it. I'm tired of not having big get-togethers at my house and, hugging my family members. And I think that's, as that fatigue gets worse, we're more likely to, worst case scenario, infect your family member, or I just got done reading an article or starting to read an article, and then I saw the time.
Thank you. I'm glad you're going to keep reading. Appreciate that.
This is from the Centers for Infectious Disease and Prevention, CIDRAP. But there's one of their experts was lamenting that his Father's Day, he did get together in an outdoor place, but didn't hug any of his grandchildren, and he was sort of wondering, like, how many people gave their dad COVID-19 for Father's Day, which you hate to say, you hate to even say that kind of stuff out loud, but we have to all be,
I hear you.
Be cognizant of what we're doing and how we're affecting others.
I don't know if you've been reading this lately, Jay, but I've been reading now that they're beginning to make a different way of thinking about this COVID. Instead of waves, which we've kind of thought of in terms of waves, which is okay, but more in terms of a forest fire.
Yeah, that's exactly what I've been looking at as well. And we're dreading that second wave, but it looks now like we're not going to have a second wave. We're just going to have a persistent burn, and forest fire is a good way to think about it. I think the analogy they kind of use is that forest fires will flare up in some places and then kind of die down in others, and then will flare up again.
Right, based upon how much basically dry wood there is.
Yes.
So
And
right now,
we're the fuel, unfortunately.
yeah, and so and so it's all about trying to keep the the fire things and all these kind of things so that these little embers don't flare, which they have in places across the country right now.
Right.
So that goes to your point about your biggest concern right now is just that folks will continue on, because that's really in terms of keeping the forest fire tamped down.
Right.
It is those simple things like washing your hands, wearing a mask,
Right.
social distancing as best you can, all those kind of things that make those embers not spark up.
And it's worth, understanding and appreciating that people have to work, and there's an economic toll.
Yeah.
And we can't shut the nation down, nor should we. But there are, there's the big pictures of people all crammed together on a beach, or those pictures in the Ozarks, and now they're actually starting to see those pictures in I saw one this morning, beaches in Europe, in England.
I saw that picture.
Yeah,
that was
right?
quite a picture.
It was, right?
Looked like a good time, but it wouldn't be one place I'd want to be right now.
Exactly.
Yeah.
And so again, the fire had calmed down in those places, and it looks like it might be flaring up again by how they're behaving. And I get it. We're sick and tired of these restrictions, but the virus isn't gone.
I was on a call yesterday with the Department of Public Health, and they kind of they have calls with hospitals every once in a while. And one of the things that I learned that I was it's sobering. It kind of goes to this keeping on with doing the simple things to keep everybody safe. Is that we're in phase 4 today?
Right.
Yay, good. To get to phase 5, we need a vaccine or a cure in terms of a treatment. So we're going to be at phase 4 for a while. And so this whole, what we do right now in terms of this kind of stuff is probably going to be the status quo for a while. And the state may come up with a 4.1 where they tweak a little bit.
Right.
But I wouldn't anticipate, from what I'm hearing, that that's going to be anytime soon a real significant change from today.
Right. Or we drop back to some 3.5, or
Yeah.
And I think I spend a great part of my day being a downer to people to say, because they're all wanting to ask me, their doctor, and do you really think we're going to be dealing with this for a lot longer? And yeah, I do. How long are you going to be wearing this mask? I'm like, deep into next year, and they're like, really. So it's just a matter of being consistent with it.
Yeah. So one of the things I'm happy to talk about is our visitation guidelines and policy. It's been pretty restrictive.
Yeah, it's been restrictive, and again, people have been understanding, but granted, it is so hard to have a family member in the hospital and you or no one in your family can see them. So I get the concern that we hear daily about not being able to see their family member.
So it's we're as of Monday, we're transitioning to a new policy that's a little bit more lenient. And for the details, I definitely would refer you to our Facebook page or our website. You can get more information. In general, which we physicians tend to be good with the generalities, right? Yeah. So in general, office-wise, not a lot of big changes. We still want folks to come in the offices on their own, other than like on cancer visits. If you're going to get an OB ultrasound and you want to both take a look at the baby's ultrasound. There was a couple others.
Well,
that
patients that if they can't, if they have trouble making their own decisions, or if they have a little bit of issues, whether it be at any age, if they need a caregiver with them, difficulty with ambulation, wheelchairs.
Yeah, so those kind of things.
Yeah.
So the clinics would be pretty similar with just a few tweaks. On the hospital side, if you're going to have a procedure done, we are moving in the direction that you can have a visitor with you, but there's a process for that, and basically the patient gets checked in, and then after the patient gets settled in, then we get the visitor. We call the visitor, and the visitor comes in and gets checked in, and you can only have one visitor for that thing. You can't switch visitors to have one visitor, multiple visitors throughout the day, just one for the day. So procedure-wise, there'll be one visitor, and then if you're in the hospital and a patient in the hospital, you're going to have one visitor from I think it's 1 to 8 p.m., 1 to 7 p.m. My bad.
Yeah.
I'm not good with military time, so it was
preferably
13 to 1900.
13 to 1900.
Yeah, my bad. So we're gonna have that, and I think that'll at least we acknowledge that we want to get families with their loved ones as best we can, and that's a way that we think we can do it and keep it safe. We're doing it afternoon visitation hours, understanding that some folks have work schedules that makes it tough because a lot of our procedures happen in the morning, and so we're trying to kind of distancing wise try to spread that out a little bit. So that there was a lot of conversation and thinking that went into this, and this is what we're going to try and start with and kind of go from there. So more details you can look at it if you go online, but I just wanted to let everyone know that starting Monday, that's going to be a new change.
I did like that it was preferable but not in stone that it was the same person visit each day for a family member, so that we don't have a new person each day, which is a new potential exposure to.
Right. Yeah.
I know they said they would make some exceptions, but at the same time, that's the goal, is to have the same one person come visit you on each day you're there.
Yeah.
So you can have a support person, but not like a different support person every day.
Right. Right. So I'm gonna switch gears now a little bit and just ask you what's it been like right now for you in terms of getting patients who have chronic medical problems, getting them taken care of, and also patients who have need colonoscopies and vaccines and that kind of stuff. How's that working out? How are you catching up with all that stuff?
Well, catching up is right in that we had so few people that we saw and when we were on our tightest restrictions. But in general, even when we were at our worst restrictions, we tried to get our kids who needed immunizations priority to get in, so that no one would fall behind on their immunizations then. And there has been a few people that have waited too long to come in to see me because they're afraid to be exposed to anything. And people with worsening cardiac conditions that quite serious, and some of them showing up in the ER, some of them showing up in my office where they even knew, well, I just didn't want to come in because of COVID, and so that's another a new education that we're trying to reinforce with people is to really still call your doctor, still go to the emergency room when you have to, still come to your regular office visits. We're doing our best to keep you safe, but most importantly, we still have to worry about our heart disease and heart failure and all that kind of more important than COVID is heart disease, right? Right. So
and so to that point about just trying to keep you folks safe. I mean, I was just out at Lynn Blvd this morning and chatting with some folks, and it's a busy office. So can you kind of speak to what you all are trying to do to make sure that is safe for both the patients and the staff?
I mean, I think the first part is limiting how many people come in with their loved one. Again, almost always we see just the one person there. We used to always encourage a spouse or someone to come with a visit, but unless it's absolutely necessary, we want less people in those waiting rooms and in the exam rooms and just passing by each other. We physically removed more than half the chairs in the waiting room so that you can't physically get close to people. We're trying to get the follow-up appointments scheduled in the exam rooms rather than going back up front into the waiting room. So again, less interaction with people. And then we're doing after every patient, we're doing the full sanitation of the whole room.
Yeah.
So that slows things down a bit as well. Yeah. So trying to keep all of these things, and of course just universal masking for everybody that's there, and every patient that comes in is expected to wear their mask.
Yeah.
And very early in the process, we had someone come in and they didn't want to wear their mask, and we said, "Well, I'm sorry, we can't see you." A lot of people don't want to wear the mask, and I know nobody likes to wear the mask, but it's still what we have to do right now.
Yeah. Just even another little thing, when I was chatting with the receptionist in your office, they've gone to, for like patients that need a follow-up appointment, the nurses are starting to schedule those so there's not as much congregation in front at reception.
At the end of the visit, that's what I was referring to. But we leave the patient, instead of, usually I'd be done with my visit and I'd say, please stop back up front. And we have a lot of signage that we had to take down that said stop up front at the end of your visit. Now we're like, no, wait here, we'll get your appointment, and then honestly, don't say hi to the receptionist, just walk right out, And,
Yeah.
We've had the same receptionist there forever, so they're always like, hi.
Yeah.
Like,
No.
No. I know, talk to Jenna.
Give him a peace sign. Keep
moving.
Good. And you have a lot of good folks out there, your staff and your hospital that work out. The thought was that it takes a village to take care of patients. Can you talk about your village a little bit?
Sure, Team Reter. But no, my nurse Julie has been fantastic working. When the worst of the restrictions were on, and we were seeing a lot less patients, her job was no easier and probably worse because the phone calls kept coming. And she spends the lion's share of her day on the phone, and my MA Megan was helping out as well, but still, that part felt like, from my standpoint, some of those days I felt like, well, I'm going to be home early, and I had a lot of paperwork to do,
Sure.
But I wasn't, and I was doing the Zoom visits, and that worked out well, but it's been crazy. I can't function without them. They keep my practice going, and it's managing all the phone calls, being that friendly face. And I do get a lot of compliments from my patients regarding both Julie and Megan that they're great, they're fantastic, and they are. And my receptionist, we have lab back there all the time now that draws blood, and so that's another convenience that the patients, and another face that my patients get to know.
Yeah.
So
yeah.
No, it's been great, and I know there's no way I can do this job alone, and so many things I think we doctors sometimes take a lot of the credit for.
We do?
We do. Yeah, we do. Like, well, I'll make sure to get that paperwork done for you.
Oh, yes. Yeah, good. Hey, I have a question from one of our listeners.
Sure.
Doctors, what are your thoughts with schools mandating masks in the fall?
Well, I think it's going to be. I think it's just going to be reality. I think that's part of public health recommendations. I think it's going to do. I think it's going to do very good from spreading this further, and also the amounts of common cold, strep, and real influenza. The question I keep getting is like, yeah, but what about the littles? How are they going to enforce keeping their masks on and all that? And I don't have a good answer on what that's going to look like yet.
Yeah.
And what about the littles when they drop their masks? And what does that mean? Do they put it on again?
Yeah.
And how are they going to enforce that? And how are they going to discipline that? And I think it's easy. The junior high age, most of the elementary school, the high school kids, they'll be fine. They're going to get it. It's going to be a little harder for that population that we want to continue to protect, and so I don't know. I don't have a better answer. Do you have any insight?
I had one of our medical staff I was chatting with, and they had little kids, and they were saying that they are beginning the process of acclimatization.
Yeah, getting them used to it.
So that they were going to be having them wear the mask for a little bit of time that day, and they were going to keep increasing that amount of time as a way to kind of help them to be ready for that when the time comes. I thought that would take a lot of parental stick-to-itiveness, but that sounds like it might be worth a try.
I think that's worth a try, and I think we've got a good culture here in Sterling and in Illinois in general. You hear a lot about people traveling, even just over to Wisconsin, Iowa, Indiana, and they're like, no one's wearing masks there. It's crazy, because we're used to it. But I've seen a lot of, kids when they're coming into the office, often like sort of proud of their cool mask that they're wearing, you know,
yeah.
and honestly, since we have this culture where we're all doing it, children are a lot more accepting to do it. So I think as it becomes the norm, it's going to get easier.
Yeah.
But you know, reinforcing to them I think more important than the masking is reinforcing to them washing their hands so much.
Yeah. It's going to be imperfect, would be my opinion, in the schools, but it's better than not doing it at all.
Yeah.
So that's kind of how I see it. It's anything that we can do to kind of reduce the risk is a positive thing, because we in general, the kids, as most of you know, it's the kids by and large do quite well, or probably don't have any symptoms with this. It's that they're the people that are the spreaders, because they hug and touch, and that's just the world of a kid, and so that's the thing that we would want to try to prevent. So did we have any responders to more or less about the laundry?
They were all saying more.
I didn't answer. I didn't ask that right then. No, I wanted it to be like a little bit more. Okay, the answer is yes. That's more than 50,000 pounds a month of laundry that our laundry service puts through. It's 75,000 pounds of laundry a month.
A lot of laundry.
So I am not great at this, but I thought 2,000 pounds is a ton.
Yes,
Is
I
that
believe
right?
I believe that's correct.
Well, I'm doing the math on that.
Yeah.
Isn't that about like 35 to 38 tons of laundry?
I think your math is correct there.
Man, that's a lot of laundry. So, shout out
That's
to our...
tons of laundry, I would say.
Oh, I shouldn't have laughed so hard. I was throwing aerosol everywhere. But yeah, that's a lot of laundry. Thanks to our laundry department for all the work that they do.
Yes, thank you for sharing.
Okay. I want to switch it up a little bit. So what would you say the most frustrating part of the work that you do, Jay?
Well, I touched on a little bit, you know, is the documentation is frustrating, you know, all the work that we have to do with documenting every visit and every phone call and every medication refill, and then the paperwork side you hear us complain about, you know, we famously complained about for years, but it is a lot, you know.
Yeah.
And earlier this year, you know, they did the study about physicians and how much time they spend seeing patients and how much time they do documenting about it and doing paperwork, and it's twice as much time doing that stuff than the fun work of actually talking to people. That's frustrating. I think a lot of the medication insurance changes and guidelines, and having to do paperwork for switching a medication just because insurance decided they don't want to pay for that again, and that's sort of very, very frustrating. But
yeah, I get it.
Yeah.
Absolutely, that's a source of frustration.
Right.
What would you say the most rewarding part of what you do is?
Well, I've always been a champion of family practice, and I think it's the long-term relationships with my patients. You know, the ability to help out people when they need us to. The generational of care. I mean, it's kind of fun to see, you know, the kid and their parents and their grandparents and their great-grandparents. And now that we've been doing this for a while,
that makes you sound like you're pretty old.
I'm pretty old, but you know, I mean, we can do that from the get-go, you know.
Yeah,
but,
I get you.
But at the same time, as it continues to get rewarding when you put roots in a practice, and it's like, oh yeah, I remember when you were in the hospital 10 years ago, or you know when your grandpa died, or you know, and so again, that's the rewarding part, trying to be that person that the family can count on, and just being honest with people. Yeah.
Which you do very well.
Thank you, as do you, Dr. Bird.
It makes me, because I don't do that full time. I have nursing home patients still.
Right.
I see some hospitalized patients, but that continuum thing is really a special thing about.
You can come back anytime.
I believe you me, I've thought about it. All right. So, yeah, another personal side of this too. So, could you share with those who are listening the millions of viewers out there.
Right, easily. Million.
What led you to a career in medicine, and especially a family practice?
Sure.
And how you ended up in Sterling?
Oh,
Tell
okay.
us your story.
I will. Oh, I'd be loved. Once upon a time. So I grew up in Canton, down by Peoria, and I was in sort of a medical family. My dad was a family practice doc in a small community. He practiced there his entire career, and my mom was a med tech who also worked at the hospital in the lab, and I kind of listened to their conversations they would have, and was always interested in it. And as I got older in high school and college, and my dad actively discouraged me to not go into medicine, as he thought it was too much work and too much time, and the practice of medicine had changed too much, which we already say that.
We say that now.
We say that now, right? And the only certainty is change in medicine, but. I eventually convinced him that no, Dad, I really do want to do this, and so that's how I went into medicine. I really liked it. I really enjoyed the science of it, and then as I went into medical school and started treating people, I started talking more and more about it. I remember I was doing a rotation in surgery, and it was a long case. My feet hurt, and the surgeon looked across at me, with this enthusiasm. He's like, "Isn't this great? We get to work with our hands all day. We don't have to talk to patients." And I had just thought, gosh, this sucks. I'm standing on my feet all day, and we're not even talking to a single patient. And he just looked at me and said that, and I was like, "Yeah, that's why you're a surgeon now." And we have plenty of great surgeons that don't do that.
Different strokes for different folks.
Yeah. And so seeing patients talk to people, it was great. And so I decided in my rotations that I did like the variety of family practice of seeing kids and parents, and I go in from one room seeing a baby in the next room. I had a really rewarding experience where it kind of was that moment, like, family practice. The thing is that I was actually doing a rotation with my dad in my hometown, and I go out of, I was finishing with a well baby, and he came in and said, "Oh, Jay, you got to meet this lady." And I said, "Oh, okay." And so, I walk into the room, and she's like, "She's 105 years old." And I said, "Wow." And she was sitting there.
She had the baby? Or?
No, she was not the mother of the baby. This is in the room next door.
But
thanks for clarifying.
Yeah.
So anyway, and so I go into that room, and there's this elderly woman who looks at me with her one good eye, and my dad said, "This is my son. Isn't he handsome?" And she looked right at me and said, "No." And I said, "All right, that's it. This is my going from a baby to a 105-year-old. That's it." And then after coming to Sterling, I got a residency in Hinsdale. After I finished I went to DO Medical School, Doctor of Osteopathic Medicine. So DOs and MDs were both seen as equal by the American Medical Association, and there's DOs of every specialty, and a lot of DO representation here in CGH. I went on to my residency in family practice in Hinsdale, and Dr. Eric Coons and I were in the same residency class. He had come out here to do a rotation with one of his med school colleagues, Ron Severino. Right?
Oh, okay.
Right?
Yeah,
You know Ron and Liz Severino, who don't work here anymore. He came out here and he really liked the community, and he talked to Norm Dietz, who offered him a job, and Norm asked Eric if there's anyone else he knew that was interested in going to a small town, and so Eric told me and my wife Alice about the opportunity, and we're like, sure, we'll look, why not?
Yeah.
And this is geographically right about in between our two hometowns. I live, Canton was down south, Crystal Lake was in the far northwest suburbs, and they showed us an empty cornfield and said, "That's going to be where your clinic is." And I said, "Where do I sign?"
Field of dreams.
Right.
Field of dreams, baby.
And 19 years later, here we are.
Here you are. Yeah, here you are. Yeah. Great. Last we talked, you might have a third generation of medical.
So my daughter Ellen is she just graduated from Drake. She is committed to go. She wants to do this, She is on a wait list to get into one medical school right now, and
Okay.
she's on. She's going to get her EMT and paramedic training and work
Okay.
for a year. As so many medical classes want people that have worked in the field for a year or two.
Yeah.
And so we're proud of her. She said, she's going to do this and keep at it. If the wait room says yes, then or the waiting list, then she'll drop everything and start
Good.
medical school this year. And if not, she's going to keep moving at it.
Good.
Walter's my youngest. He's in high school. He thinks maybe he's going to take he's going to get the CNA next year while he's in high school and
Good for him.
work as a CNA. And my daughter Maya, not to forget her, she has no interest at all. She's in at Northwestern in journalism.
Okay, good.
So that's good.
Good.
My siblings, they didn't go into healthcare either.
Yeah.
So
I'm 0 for 3 with my kids. They
Really?
Nah. I go, what? No, not what you do, Dad.
Right. Everybody, they're all different.
Yeah.
You know what I mean? So who knows?
Yeah. Good. You weren't a physician, what would you be?
Ooh, I even read that question and I just sort of glossed over it. Like, what would I do? My usual answer is I have no other job skills. But I don't know. I like being outside. I like hiking a lot. I do a lot of work in my yard, which I find.
So you think you might have been a hiker, a professional hiker?
Professional hiker. I would like to walk.
A hitchhiker.
I like to walk the Appalachian Trail for a living. I don't know. Work in landscaping. I don't know. I don't know.
Yeah. Okay. Well, it's pretty much a hypothetical. So
It is.
You don't have to know.
I don't have to know.
Yeah.
So right now, I'll keep doing what I'm doing as
All
long
right.
as I can.
I think that's a great idea. I'd keep
Yeah.
doing that if I were you. I think you're onto something.
I'm sure there are easier ways to make a living, and that's something I try to tell young people that are interested in medicine. And if they start asking about, well, does that pay well? I'm like, if you go into medicine for the money, you're going to be sorely disappointed. It is a lot of work, and there's lots of better ways to make money. But if it's what you want to do, then it's a great life. Because it's a rewarding job. It's a very hard job, but it's
Good. Well, we're just about done here. I wanted to give one shout out to our listening audience and to those in our community about something before we're done, and that is, the last couple of weeks we've talked about blood shortages that we've had, and we don't right now. So I don't know if this has helped, but we've gone from red, which is like 1 day supply, to yellow, which is 2 day supply, to now we're on green in terms of all our blood products. So thank you to everyone in the community who has done what they need to do to donate the blood so that we have what we need, at least in our region.
right.
So that's a great thing. So thank you to all of you. Well, we've been going for about 40 minutes or so. It's been really nice having you. You've done a really nice job, and
Thank you.
I think our listeners have got a really good sense of you, and also some of the work that Family Practice Docs do, and also just some more information, hopefully, about COVID and this pandemic. And as always, thanks. And just for next week, I'm going to have Dr. Jeff LeMay, one of our OBGYN doctors, on here to. He's a seasoned veteran, if you will, and he'll be
yes, he is.
he'll be a fount of information and stories as well. I can guarantee it.
Sure.
So thank you all for listening, and until
I will wait. I will have to. Remember, I was supposed to give shout outs to, I'm in my Academy Awards section. Right?
Oh, go for it. Yeah.
Well, I couldn't do what I'm doing without the support of my wife and my family. My wife Alice.
Yay, Alice.
I did shout out already to my staff at the Blvd. They've been wonderful. Staff at the hospice, Rock River, also wonderful. Staff over at Citadel, who work very hard as well. So I promised myself I'd do those.
I'm glad you did. Anything we can do to thank folks for the work they do, I'm all for. So
Yeah.
thanks for listening, everybody. We'll see you next week.
Thank you.